Assalamu alaikum wa rahmatullah. Bismillah ar-Rahman ar-Rahim. So this is a follow-up question to the question about the Ruqyah diagnosis. So the questioner asked at the same time, what if the person gets possessed, or what if the jinn starts speaking while you are consulting, or what if the person comes possessed? So this is a normal thing as well. We see this a lot in our clinics and our campaigns, that family members bring people who they can't speak properly, they are unwell, they have to be lifted, they have to be sometimes in some case brought in by holding them, or they don't want to come. The jinns are manifesting on them and speaking through them. This is very common. We see this a lot. Subhanallah. This person, obviously you can't speak to them because the jinns are there and the jinns are moving the patient and speaking from them. So in this case, that you have to start treating the patient immediately by reciting onto them the relevant verses. Subhanallah. And many times the jinns will start speaking, and you will answer the jinns, and you will give them you will recite the relevant verses to answer their questions. Okay, maybe the jinns might say they don't know what is Islam. You have to recite the verse to show them Islam. If they might say they don't know Allah, you have to recite the verse to show them Allah. You have to preach to them. You have to show them Tawheed. You have to show them Jahannam as well, because some jinns they need to be burnt to understand. Okay, some jinns, they have sorceries and they have things tying them to the sorcerer, and they have sacrifices and offerings, and you have to recite the relevant verses. The Roqi must be equipped and have the knowledge and the experience to recite relevant verses to free the jinn of the person, or in some cases the jinn will burn and he will die by the recitation. And you have to know how to hold the patient, and we don't support punishing patients. This is not a proper technique. There are some people who hit the patients. We don't support this. You just have to know the relevant Quranic verses to recite onto the person, and the person will the jinns will be freed from the person, inshallah, with the permission of Allah. Or in some cases the jinns will die and the person will become normal. As soon as the person becomes normal, you have to treat them immediately. If you are in a clinic or a center, the treatment will start immediately, meaning you have to start giving them the Quranic water to drink. You have to make them bath with the Quranic water. You have to give them the Quranic oil for their skin, and they must start immediately, and they will continue their treatments at home, and then they will return to continue their treatments. The recitation to be recited on them together with the hijama, and their sorcery will be removed after a number of days, inshallah, and they will be back to normal, inshallah. In some cases the jinns keep coming. You have to keep reciting on the patient. In some centers or clinics, patients have to stay in, and the Roqis have to attend to them on a daily basis to keep reciting on them and converting the jinns until the entire case is finished, inshallah. So in this case, if the person comes and you can't speak to them, you have to start reciting on the jinns, and the jinns will be freed, or they will die, or they will become Muslim, inshallah. After this, and the person becomes normal, then you can have a chat with the person, and you can find out about their medical history, their illness, their pains in their body, what type of dreams they have, what type of problems they have in their life, if they have marriage problems, work problems. All of this will determine what sorceries are being done to them, and it will determine what part of the body that the sorceries are. So you can apply the treatment and the verses correctly, inshallah. So in this case, the consultation may take place after the person and the jinns have gone, and you can speak to them and their family, inshallah. Assalamu alaikum wa rahmatullah.